Now for our speakers. I'll briefly introduce them, but I'll put their full bios in the chat for more information because you'll want to hear about their amazing backgrounds. I first want to welcome Janice Davis-Street, Manager, Global Public Health and Special Projects for Chevron. She and her team manage Chevron's public health programs for their workforce and the communities where they operate. Next, we have Carrie Ting with Health Partnerships at Facebook. She and her team collaborate with mental health experts and organizations to leverage Facebook's platform to help decrease stigma and increase access to mental health resources. And lastly, we have Glenn Goss, and he is a mental health technical advisor for AmeriCares. Glenn has worked long years in the humanitarian aid space and in 40 countries throughout Africa, Asia, Europe, North America, and the Middle East. So with that, I would love to turn the conversation over to Ben Plumley, and we will take it from there. And I'm unmuting everyone. Here we go.
Lovely. Thank you, Sarah. And let me add my welcome to everyone. As Sarah said, I'm a senior advisor to the Bay Area Global Health Alliance. I'm the founder of the Hunavat Global Health Strategy Agency, and I'm a host of a Shot in the Arm podcast. And this webinar is actually in conjunction with the current episode of a Shot in the Arm podcast, where I chat with Dr. Huma Abbasi, the Chief Medical Officer of Chevron, on emotional well-being in the workplace. So as Sarah said, we've got about 40 minutes discussion, and then we'll take questions. You can post them on the chat function of Zoom anytime you like, and Sarah and I will make sure that we get through as many of them as we can. So let's get right into it. I think one of the questions that we were looking at as we were preparing for this session is just, what are we talking about? Mental health, emotional wellness, resilience. What I'd love to do is ask our panel, what definition works best for you? And if I may, Janice, can I get you to comment first? What definition works best for you?
For me, I like to look at it more from an emotional well-being perspective. So we typically will think of mental health being more of a therapeutic kind of term, and look at things like anxiety and depression would fall under that mental health umbrella. But in this general conversation, we like to look at the whole emotional well-being aspect, because I think it decreases some of the unfortunate stigma that comes to mind when people hear the word mental health. But I think everyone aligns with the notion that we need to take care of ourselves emotionally, and there's a better connection in our programming when we look at it from an emotional well-being perspective and lens.
Thanks, Janice. Glenn, your thoughts, particularly as you work with a range of frontline healthcare workers around the world.
Sure. We use the term mental health because, well, being the mental health and psychosocial support technical advisor, and also because humanitarian workers love to have use jargon all the time. But I agree with Janice. I mean, it's really about emotional well-being of the frontline healthcare workers as much as it is their clinical mental health. I would also add the word resilience to it as well, because we need resilient healthcare systems, countries, ministries and departments of health, and the whole system to work together well on their behalf.
And Carrie, you work with Facebook. You have an external facing role, developing tools and programs and approaches for users. What definitions, besides working best for the company, are ones that users really relate to?
It's a great question. And we would agree with Janice and Glenn, actually, that at Facebook, we really try to take a holistic approach to mental health that includes our emotional well-being, psychological well-being, and social well-being. We really work closely with experts in the field to help us to think through how to help people to navigate mental health challenges by increasing education and awareness about signs and symptoms, teaching coping mechanisms, as well as kind of bolstering those protective factors. So would echo what Janice and Glenn shared as well.
Thank you. So I think we can all see that there may be a few different words, but the definitions are comprehensive and ones that we all share. Another question for all of you, and Glenn, maybe I can start with you. This last year has been extraordinary, but I wonder how your response has differed from other public health emergencies or disaster management strategies. And I think it seemed to many of us that we're not only fighting a viral pandemic, but we are fighting a pandemic that affects people's emotional well-being and mental health. What has really, stood out to you?
Well, AmeriCares is a health-focused relief and development organization that saves lives and improves health for people affected by poverty and disaster. So that's our mission. But within that, we were very used to being on the ground with people, definitely sending medicines and supplies and teams. And it's radically changed the whole humanitarian sphere in the last year, where we've been working more virtually, but at the same time, we have also clinics on the ground in El Salvador, Colombia, India, mobile health clinics, and also mental health programs in places like Malawi, Philippines. It's been very different because I think that the pandemic has exposed the whole equity issue of those who are not able to receive services. In the mental health field, there's an 85% treatment gap of people who are not able to access mental health services worldwide. In the United States, it's 70% of people of color are not able to access mental health services. So there's quite a huge gap, but then the pandemic has exposed it. And at the same time, because we are responding to disasters, we're working with the wildfire response. In fact, we had a wildfire response in California that turned into a pandemic response. And now we're talking about how do we need to shift back to which of course we will be shifting back to a wildfire focus pretty soon, unfortunately. But it's that complex humanitarian emergency, multi-layer type of approach, and keeping in mind of the huge toll that it's played on the frontline healthcare workers, their resilience, their being on the edge of burnout or even past that, and trying to find ways. We've developed webinars and various tools that get to the frontline workers, because a lot of us as humanitarian workers and healthcare workers are not the type of people to reach out for help. So there is stigma and discrimination, but there's also this type of stigma against mental health, and how do we bridge that gap?
There's a lot there, Glenn, that I'm going to want to unpick and come back to later in the conversation. But Carrie, can I ask you the same question? I mean, Facebook has been in the news a lot over the last 18 months or so, but it's been really interesting, I think, for many of us working in the public health sphere, that we just go to our phones and go onto Facebook, and we can find out the very latest about what is happening with COVID in our districts, our counties, or wherever we are. As you've come on board with Facebook, how have you seen the company sort of muster a much different kind of response using the social media platform?
Yes, absolutely. So at Facebook, we actually have a growing health team that has expanded over the past year in responding to COVID. We focus on everything from combating misinformation to trying to scale access and destigmatize mental health, as well as thinking about the reach of COVID vaccines and how our platform can help to accelerate people finding and learning more about vaccination. So mental health is one of the priorities within that. And we're really focused on how do we collaborate with global health organizations to build products and programs that will improve public health and health equity within the mental health space.
And Janice, you know, we think of Chevron. I guess here in California we think of gas stations, but Chevron is much more than that. And I wonder if you could talk about how, you know, whether it is the crew of your fleets or people on offshore drilling platforms, how have you had to manage the COVID response over this last year?
I think, you know, I would say, if I had to put a phrase that could be tied to our response, I would say it's been the best of times and it's been the worst of times. And I'll tell you why I say that. Let's start with the best of times. It's been the best of times in terms of our ability to work together. So emergency management folks, with health professionals, and all of these different aspects within the company, we had to team effectively to address the unique needs of our workforce. As you mentioned, we are a global company. We are in multiple countries dealing with multiple cultures, all united by our desire to face and manage the pandemic, whether people are in an offshore platform, a refinery, a lab, an office building. And so the ability for us to collaborate and work together has brought out the best, I think, of our organizations. But of course, we're dealing with unprecedented stressors. And I think a big piece for us in this last year was, you know, I like to call it the trifecta. We had the pandemic, we had social unrest that continues, or, you know, social, you know, whether it's the reaction to our Asian American colleagues, or whether we're talking about what African Americans have had to be dealing with as part of movements like Black Lives Matter. As well as the impact of the economic downturn. Our organization went through some major organizational changes. All of those things had impacts on our workforce's emotional well-being and resilience. So it's been an interesting time period for us to have to look at things like our organizational resilience, our ability to work together, in terms of how we've had to deal with these different aspects of the disaster.
Again, a lot of stuff there that I want to come back to, Janice, if that's okay. But Glenn, a question for you, and talking about healthcare workers for a moment. How does mental health resilience factor into how health workers can do their job? You've mentioned that it's not something that doctors, nurses, other healthcare professionals necessarily want to admit to, but if you don't address it, it can add additional stress to the system of healthcare, the ability to deliver the services that are so crucial now. What approaches has America taken? And it would be really interesting to know, particularly what you're doing in India at the moment.
Right. Yes, I was talking to the India team this week about the staggering statistics of the pandemic there. But I go back to 2017. Before I started working with AmeriCares, I was with a global mental health group with Harvard, with the refugee trauma group. And I was giving a presentation on resilience, on compassion fatigue, secondary trauma. And they paired me with a doctor from an internal medicine specialist from the National Health Service. And he made a presentation about the numbers of suicides in the profession of doctors in the US and the UK, and the need for, obviously building resilience, but also looking at the whole of the healthcare system and of course, the doctors and even the nurses and other medical practitioners' responsibility to look out for their own mental health, but also for their teams and for the whole of the organization. And I remember there were two gentlemen there who were representing major healthcare operations in the United States. And after I gave my talk, we all talked together about how the systems are not built for resiliency and longevity of their medical staff staying with the profession. So this was something, there were cracks in the system long before the pandemic came. And of course, with the pandemic, one of the number one issues that healthcare workers had was they didn't want to transmit the disease, of course, to their family members, to other staff, had to make moral decisions about who would get ventilators or many of the things that you've seen on the news. And we started to develop with AmeriCares a system of getting information out to these healthcare workers through live webinars, through learning management system courses, and through, I think one of the best things we've done is to just simply talk to the and debrief teams within the clinics. I remember talking to one clinic and they said, one of the things we've had to deal with is we've gone online, and then eventually we came to a hybrid model where we have some patients come to the clinic and other ones are online. But we have a lot of elderly and in the Hispanic Latinx population, and they're actually very frustrated and angry that they can't come into the clinic. And how do we deal with patient anger and frustration? How do we deal with, the fact that, we're running a free and charitable clinic. Most of our staff are volunteers. Many of them are retired and are older in age. And of course, this was back before the vaccine. They were wondering, how are we going to even staff the clinics? And, helping them build resiliency and, triage and look at, all the issues and be able to break it down into something that's manageable for them it's really been a highlight of what AmeriCares has been able to do. We work in 90 countries worldwide every year, but there's 12 of them specifically with mental health. And then of course, the United States being a major part of that. So I'm looking for, it's like what Janice said, it's been the worst of times and the best of times, I think, as well for AmeriCares. And we're looking forward to keep building on those successes for those, especially for those free and charitable clinics.
I mean, Carrie, so the flip side, if you like, of building resilience is decreasing stigma and discrimination. And what resources has Facebook put together to help users access services?
Yeah, absolutely. So our mental health team's mission is to support people in their mental health by working with mental health experts and organizations to develop and leverage Facebook's platform and products to help decrease stigma and also increase scale and access to these resources. One of our first efforts in this space is launching what we call the Facebook Emotional Health Resource Center. So this is really a resource center where people can access tips and resources from mental health experts that we've worked with on a number of guides. People can also connect directly with crisis helplines if they're in a state of crisis in their local community. There's also an opportunity to connect with a friend and also connect directly with mental health organizations and Facebook groups where people can find more support. In the US, we've also worked directly with organizations that focus on communities of color to address the specific needs and stigma that these communities are facing. And then globally, we've worked really closely with experts on the ground, understanding that there are a lot of nuances in how people experience mental health in all the different countries around the world, and also barriers to access that I'm sure Glenn is very, very familiar with. So that's a snapshot of what we're doing on the research side.
Thank you. And Janice, question for you, I think building on what you referred to in your last response, and it was something that came up in the podcast with Huma Abbasi. It's something that you have really been firmly committed to speaking out about Black Lives Matter and the Stop Asian Hate movement. And it'd be really interesting to know how these have affected and driven Chevron's engagement with your workforce, your customers, and your broader stakeholder community.
I think, one of the things that I am so proud of being a Chevron employee is the way that our leadership has responded to some of these social issues. I think when we think about health, sometimes we forget that people's ability to bring their whole selves to work is determined by their emotional well-being. And that connection between topics like diversity and inclusion and emotional well-being, those are all really very, very much connected. I think the big things that we've seen is our most senior leadership and our middle levels of leadership is this willingness to listen and learn. And there's been a whole lot of sharing and conversation about both of those issues, about the impact of systemic racism on African Americans, as well as what the anti-Asian sentiment has been in more recent times. Those conversations and the willingness of our senior leaders to stop and listen and understand, I think has permeated our culture, where we're all taking the time to listen to each other and seeing how these social issues impact the ability of our colleagues and our friends to bring their whole selves to work. It's been something that I've been so impressed by and so very, very proud of Chevron's response.
And Janice, how has that affected your ability to do your work? How, in practical terms, have you been able to adapt or expand the kind of programs that you offer for employee wellness?
I think it's opened up the conversation because we are talking much more freely about things like stigma and discrimination. Those are all topics that maybe were lines in an OE moment or in a health moment or a health node. I think it just elevated the level of conversation that we've been able to have on those topics. One of the interesting things about the timing of all of this, I keep saying that we should have probably bought lottery tickets, because in 2019, we launched a mental health campaign. And then in February, we enhanced our resilience resources. So both of those two things kind of positioned us to have some things in hand when the pandemic evolved. And so I think with the changing climate about listening more and learning about each other and seeing how these different elements can impact people's mental health and well-being, we've been able to use those tools from those campaigns to have better conversations. And I think that's the one thing that's changed in my mind, is there's a more openness and recognition of these factors around psychological well-being that has enhanced our ability to deliver related services.
I think that's incredibly important, Janice, and kudos to you and your colleagues for playing such a leadership role here. There's one question, I think, building up on everything that you all have said, which is around the commonalities or differences between the needs of different cultures and the needs of different countries. I mean, all three organizations, America, Facebook, Chevron, you're working in so many countries. And Glenn, maybe I could start with you, but I'd love to come to our other two panelists as well. Just what are the commonalities and differences that you've seen, particularly over the last year?
I'd like to start with Tanzania. I was talking to the medical staff there a couple of weeks ago, and I asked them about the coronavirus situation there, and they said, well, there's been a lot of denial about what's happening in the country, but we also fortunately haven't had a lot of cases, but we are dealing with the normal kind of burnout and, you know, also realizing that we still have to face the pandemic. There's potentially going to be, you know, an upswing in the case count here as well. And I asked them, I said, well, what do you do in terms of resilience building for yourself? What are the, you know, what are the factors? And they said, Ujama. I said, well, oh, what's that? That's a Swahili word that means community. It means that, you know, all of us come together, and it's like the Zulu word Ubuntu, which means, you know, we're greater together than we are just individually. And so there's a lot of things that we do together. And I think this is sort of some of the commonalities that I see across countries. Just this cultural resilience, of course, the resilience of and strength of women in the villages, and where the strength of you know, leaders coming forth and tackling these kind of problems. And what we're trying to do in Tanzania is help them to build a staff care component into the regular medical training and safety training that they're doing. This is something that they haven't thought of really much in the past. In Malawi, we're also working on a similar program to train healthcare workers. I think one of the strategies that we have is that, you know, with an 85% treatment gap, and you know, maybe just a couple of psychiatrists in a country, we're really working on training healthcare workers with very basic mental health skills and resilient skills. And that's something, that's a commonality or something we can do right across the world. Even in the United States, in rural areas or in underserved areas, you know, just really getting to know the clinics, getting to know their unique needs that they have, like, for example, the patient anger. And we were able to just pivot and to change our training and our way of doing things. And I think this is a time where people are reaching out more, in a sense, for what do we do now? I think, you know, probably after the pandemic is on its way out, hopefully, you know, we may go back to just a laissez-faire type of, you know, we don't need to take care of our staff anymore. But I think that's changing in a number of countries. It's really good to see.
Carrie, in terms of the different approaches that Facebook has taken with user groups around the world, whether it's the Facebook algorithms, whether it's the sort of intuition of the health partnerships groups, what do you see about commonalities and cultural differences that you've had to take account of when say, fighting stigma and discrimination about mental health?
Yeah, that's a great question. So to launch Emotional Health, we worked closely with the WHO as well as partners that were local in Brazil, India, Nigeria, South Korea, Norway, and the US. So spent a lot of time with these partners specifically to understand what are those nuances that are different across countries. And it was really important for us to understand and learn from these local experts so that when we did work with them to deliver these expert resources through our platform, that they are relevant and resonating with the communities that we're trying to serve. We also, before we launch any Facebook product, we work really closely with our research team who conducts kind of user group interviews to understand how local users in Facebook might be using the product differently so that we can take those nuances into account. And so we really learned through those conversations that there can be a lot of difference in terms of the language when people talk about mental health, the stigmas that they might face, access to resources and other barriers in accessing mental health. So for example, one of our partners in Korea, she mentioned that the way that grief is discussed and talked about in Korean culture is very different than how it's articulated in Western culture. Another partner in Nigeria highlighted that when we're highlighting these tips, that really practical tips around self-care are very beneficial for communities when they don't have access to professional care. And then in the US, some of the elements that have come up is that for the Asian community, this idea of saving face can be a huge barrier in someone's willingness to reach out and ask for help. And for the Black community, it's been called to our attention that only 5% of therapists in the US are Black. And so how does that play into someone's willingness to access resources, seek out therapy that might be culturally competent and resonate with them?
And Janice, just briefly from your perspective, putting together emotional wellness programs for employees in different settings around the world, how have you had to adapt, or how have you had to reframe things to meet the needs of communities?
So very briefly, two things that that come to mind. First of all, are our dependence on our relationships with our local medical teams. We're very fortunate to have an internal EAP services. And so our EAP works very closely with the local folks to make sure that how we're dealing with these issues makes sense.
Janice, let me just dive in and ask you to define EAP.
EAP, Employee Assistance Program, which we are licensed professionals who provide emotional and mental health services to our workforce. And so that's a big piece of that, working with our local medical teams and our local resources, whether it's a local vendor or otherwise, to make sure that our services are culturally appropriate. The other area is we leverage our employee resource groups, or we call them diversity networks, to have some of those more deeper conversations. So we are making sure that what we're putting forward in the well-being space, be it physical or emotional or mental well-being, is appropriate for the group that we are trying to reach and support.
Well, thank you. And now we're going to open it up to questions, which are just pouring in. So thank you very much. I'm going to start with one from Lydia Hens, who asks, and I think this is a really crucial one. I don't know if you've watched it. If you are interested in some binge watching, there is a fantastic documentary about one of the cruise ships, the one that had to dock in Japan at the beginning of the pandemic, and just to see how their health workforce on the ship had to deal with changing news that was coming from CDC and other places. But Lydia asks the question, as our knowledge of COVID-19 grew throughout 2020, how did you all pivot to best support health workers? I note that Lydia is a colleague of yours, Glenn, so maybe I can start with you, and then I'll bring Janice into the conversation.
Well, yes, as I mentioned before, just being able to talk to our clinics on the ground and find out what are the actual issues that are affecting them. There was a study that Sarah sent me yesterday. I think it was a Stanford study that said that up to 20% of medical staff are at risk for PTSD or showing at least one of the symptoms. So, we went back to some of the things we used to do in the past, which are, to really work on the signs and symptoms. And I think the bottom line of the study was that early detection of, burnout and, being able to get to the staff. I'm sure also with Chevron and Facebook as well, being able to really be proactive and preventative in terms of and helping, managers to understand or look for signs, to be able to talk to their teams, a team management approach of, helping to spot things, and then to have a system whereby we do also have an employee assistance program, but also we're also now working with 7 Cups, and we've talked to Crisis Text Line as well about how we can access even faster, so our employees and then also the healthcare workers can access mental health services in a much more rapid fashion. I mean, for somebody to be on the New York subway and to have a panic attack and to be able to crisis text line and get a text right back. And okay, these are the 3 things you need to do to bring down your breathing and cope. And, you know, as they're sort of walking out the subway, that kind of technology is, we're really trying to harness that. We do know there's limitations to that as well, because obviously in Malawi and other places in El Salvador, we have been contacting people with using the telephone service because they don't have computers access or internet access. So, you know, being able to shift during COVID to be able to find patients who are very isolated and to have contact with them, even if they can't get into the clinic. So a myriad of things.
And Janice, I mean, I guess this comes down to a question of trust. I mean, in a sense, you're lucky because you've got clinical directors around the world that people are looking to, that employers are looking to provide the latest information. But how did you do that? How did you keep them briefed and updated and give them tools that they could share in ways that employees trusted?
Yeah, so we did stand up a corporate pandemic response team that did include the crisis management teams globally. Our regional medical managers, our general manager, and other health professionals were all tied in to the CPRT, the corporate pandemic response team, to keep individuals apprised of the different changes. One of the things that I think, in addition to some of the things that Glenn mentioned around, you know, the role of EAP and technology and all of these other aspects that I thought was very important, was having a plan to support the people on the front line, having a sustainability plan so that people could tap out. Because I think the being always on and on the forefront of being able to respond is prime for burnout. And having thought through kind of what is our tap out mechanism, who's going to back Dr. Bassiev, who's going to back the regional medical managers, that I thought was an important part of the response as well.
And Carrie, just picking up on this trust and support question, so much changes so rapidly. How has Facebook been able to able to distinguish the wheat from the chaff, the accurate information from the misinformation? What have been your strategies there?
We work really closely with partners to help us understand what is the accurate information that's out there. And so they really help us on an ongoing basis understand and evaluate what information is being put out there, and then how we update our policies to respond and be very reactive to the information that we're seeing. I think another way that we think a lot about building trust is, you know, working with these partners on a series of campaigns as well around, you know, how do we think about destigmatizing, as Janice mentioned, and the topic of mental health. And so have worked really closely with partners around a number of different campaigns for you know, Mental Health Awareness Month. We work closely with the WHO for World Mental Health Day, and our upcoming collaboration for BIPOC Mental Health Awareness Month in July with a number of partners within the BIPOC community as well.
Now, we have a question that's come in from one of our board members, Ponima Mane, board members of the Bay Area Global Health Alliance, and it's been echoed by David Hausner from PHI, which is also a member of the Alliance. But Ponima asks, I was wondering if any of the organizations are focusing on dependents and loved ones of those who are infected with the virus. Yes, communities do help members, but what is being done to address the emotional health and well-being of the needs of loved ones represented by the organizations here? And David adds, absolutely, but also what do we do for the families who have lost loved ones? And Janice, maybe I could start with you.
Yeah, I think our EAP organization has really been tied into addressing the issue around dependence and loss and grief and all of these aspects. From a work-life perspective, targeting families and dependents has been a priority for our work life team. And they've done a really nice job of being very innovative in the way that they're doing that. But this has fallen into the capable hands of our EAP resources to be the ones to be on the front line of addressing this aspect.
Another question that has come up, and I might sort of try and pool this with a few others, from Lisa Carl, is around the role of innovation. And Lisa raises a number of apps. I think, Glenn, you've referred to them, 7 Cups or Talkspace, and how we can utilize those technologies. But what do we do in populations where they don't have necessarily access to these kind of applications? And one of the other questions that I think is related to this came in from an anonymous. What impact has telehealth had in providing emotional well-being for employees and dependents? And are these kinds of technologies and approaches, are these the future of mental health service? Glenn, do you want to start?
Sure. In the Philippines, we have had a psychosocial mental health team that's been working with healthcare workers in the very rural areas where there is very little internet access in some of the very rural islands. And, we've just been able to make contacts with people and networks throughout the villages, and where you can't get a message through by internet, you get it there by walking, and you get there through other means. And so, while the telemental health services work extremely well in certain urban areas, and where there is access, in places like El Salvador, we've used telephone contact. In India right now, we're looking at both telephone contact and in telehealth. And also when, we're able to go back to working in our mobile health clinics, figure out how to reconfigure those to helping these problems. Another big aspect here is the aspect of grief and loss, and being able to have really good information about and specific to their culture, ways that they grieve, ways that they use rituals and religious and spiritual ceremonies, but also just the basics of the grief process itself. And of course, the pandemic is coming and going in waves, and so there'll be a number of waves that'll probably last a couple of years. And so we're really thinking about those aspects as well.
Carrie, could I put the question to you, and with a particular spin? I mean, you think of technology, and you think of, millennials, generation X and Y, but in many settings around the world, the social network platforms, particularly Facebook, have been a resource for older populations. And I wonder how Facebook has embraced that. So providing services for folks that, for whom, and I know my parents are like this, for whom finding the on button can be a challenge.
Yeah, absolutely. I mean, we find that when people are seeking out mental health resources, we really try to serve all different parts of the population. And I think your question was around like how we address the needs of maybe the older generation.
Yeah.
So we try to make the ease of access when we design the products to be as simple as possible. Oftentimes what can happen when one is seeking out mental health resources is that it can be overwhelming, just in terms of all the different resources that are available. So that's something that the Facebook team can really bring in terms of, we aren't the experts in terms of the content or the resources. That expertise lies with our partners, but we can help figure out how do we make this and design our products in a way that is easier for people to access that information. And I think, another way that we really think about that is like meeting people where they are. So we find that people use Facebook in so many different ways. It really is for some kind of a way that people engage with many of their different life activities. We've heard that Facebook groups can be really powerful for physicians who are extremely busy and may not even use Facebook typically, but they are connecting in these groups as a source of how to cope with the grief that they're experiencing, how to support each other during this time. So a lot of it is trying to figure out, where are people seeking out this information already on Facebook, and then how do we meet them and support them where they are with the resources that we've developed with partners.
Thank you. So I guess one final question for all of you to reflect on as you look into your crystal balls. I think you've all mentioned that we may not necessarily go back to the way things were before, but what do you think the future of emotional wellness programming looks like? And Glenn, can I start with you here?
Well, when I think of the future, I'm really thinking of where people do not have access to mental health services, and particularly where mental health and health care itself is not seen as a basic universal human right. So, we still, with the pandemic, we still have people who are chained for, having, being in a mental health condition. We have issues where women and children are not able to access services, and they're subject to human trafficking, FGM, all kinds of gender-based type of violence. So we're really looking at the whole idea of protection in mental health, so that if people are protected and they have access to these services, and as Carrie was talking about, decreasing that stigma, we're able to, and then of course, linking arms together and developing strategic partnerships with other organizations and corporations. That's really the future for us at America.
And when you said FGM,
yes,
you were referring to female genital mutilation?
Yes, that's right. And other things like forced marriages, and when there's a disaster as well, women and children, but also men and boys in other circumstances are very highly vulnerable. So we're always looking at that and increasing our humanitarian response standards and ways of making sure everybody's included.
Well, while you've still got the floor, Glenn, and before I come on to Carrie and Janice, there was a question that came in from Eric Weintz around as an emergency physician on the front line, he doesn't necessarily seek out the kind of support and feel like I don't have time or space to seek out mental health support. How does Americares go about offering this and advertising this in emergency disaster settings?
Well, we do have networks, as I mentioned, the Free and Charitable Clinic Network in the United States and federally qualified health centers. Because we're really looking at specifically in the area of poverty, areas of poverty, and where there is, of course, upcoming disasters. We're also preparing, we have disaster preparedness classes that with mental health, integrating that together so that we're ready for the next one. But for emergency room physicians, it's really, really tough. I was actually with an ER physician from Minneapolis this weekend on a yoga retreat. So I decided I needed to get away and just to see the bigger picture again. And here was this ER doc, and I was really amazed, just glad that she was just taking the time to take care of herself and recharge so that she can help her patients there. Because she mentioned to me, the moral injury, kind of issues of, not having enough supplies or having to make life and death decisions about her patients and really needing to take a step back. I know it's just not, with their work schedules, it's extremely difficult, but we're really trying to, to give them the resources when needed, when they can.
So Janice, your sense of the future, how do you see your team at Chevron taking what has been learned from this extraordinary year and then strengthening the kind of emotional well-being services that you provide?
I think what we can take from this is acknowledgement that physical and psychological well-being are intrinsically connected. And no longer can we look at one without the other. It's such they're so connected. And I think that visibility on both aspects of health will continue internally in our programming, externally as we look at some of the work that our partners are doing in the public health space, that we are looking at how we're looking at health systemically, like how are we looking at, groups that are looking at things like behavioral health supports, as they're also supporting groups around HIV, AIDS, TB, and malaria, and all of these other areas that we have passion around. The psychological well-being aspect of all of those services to continue having visibility into this whole person look at our people who work for us and those who are outside of our fences as well.
Thanks, Janice. And Carrie, I guess this is the million-dollar question, and one I've been dying to put to you throughout this session. What does the future look like, and what role will social networks like Facebook play?
We really hope that, as many of these interventions and resources come online, that we can help just be a partner to the many amazing experts and organizations in the space to help amplify and scale those resources. When we think about destigmatization, one hope is that, the pandemic will have, because COVID unfortunately has exacerbated mental health issues for so many, that hopefully this may even move the needle slightly around that destigmatization, but there's so much work that will still need to be done after this. And so we hope to continue to work with partners around campaigns that can help destigmatize the topic. And then I think just from an equity lens, I think this year has really opened up the eyes to many around the world around so many of the inequities that face our world as we navigate a pandemic and think about, race within our communities within the US. And so I hope that, the world will continue to design for these sensitivities around cultural differences. And it's something that we are definitely making a priority as we think about how we develop programs and products in the space.
Well, I think we're coming up to the top of our hour. I'm going to hand back to Sarah in a second to wrap us up, but I just really want to thank the three of you and the organizations that you come from. I'm as someone working in sort of emergency infectious disease responses for, gosh, Sarah, it's too long to recall, isn't it? I mean, for a while, but it's been so interesting that mental health has not been a top priority. And so it has been really interesting and rewarding to see how, in very different ways, the three of you are doing this. So a real thanks to you, Janice, Carrie, and Glenn. A reminder that you can learn more about emotional wellness, listening to a Shot in the Arm podcast with Dr. Huma Abbasi, the Chief Medical Officer from Chevron. I know that the Alliance has many resources available to members through our website and directly through Sarah and colleagues. So it really just remains for me to hand back to Sarah to say a few closing remarks. Thanks, Sarah.
Thank you, Ben. And thank you so much to Glenn, to Carrie, and Janice. This was just really great. I'm so glad that you guys could share some light on such a neglected issue. I mean, I've worked in the health and global health space, and there's always been so much stigma, and there always has been, this one is the one that people don't get to. And I almost feel, Janice, I loved what you said about how our physical well-being and our mental well-being are all tied together. And I think all of our panelists would agree on that. This is for our guests. Thank you for coming today and sharing, if you're here on the West Coast, your lunch hour with us. This is just an example of some of the cross sector conversations we want to have, and kind of have diverse voices kind of talking about the same subject areas and bring different perspectives to light. We like to try to see that in a different lens. So we just want to thank you and invite you, as Ben said, to come to our website and see all the different events, not just the Alliance events, but all of our members are doing something. And that's kind of a silver lining in this pandemic, is that there our reach of being able to share learnings and opportunities with each other has grown. But with that, I just want to say thank you once again to everyone, especially to Ben and our panelists and to all of our members, and to say thank you and come join us again, and do take care. It's rough on everybody. And I know all of us have kind of been under assault, even in the best of circumstances. So I hope everyone takes care and have a good day. Thank you.